Hello and welcome. Have you ever heard of keratoconus? It's a progressive eye disease that affects the cornea, the clear front surface of your eye. In this video, we'll explore keratoconus in detail, covering its causes, symptoms, diagnosis, and available treatments. Let's dive in to better understand this potentially vision-altering condition. The exact cause of keratoconus remains a topic of ongoing research, but we do know several factors that increase the risk. Genetic predisposition plays a significant role. If you have a family history of keratoconus, your chances of developing it are higher. Environmental factors, such as chronic eye rubbing, are also strongly linked to the condition. Certain systemic diseases like Down syndrome, Ehlers-Danlos syndrome, and Marfan syndrome have also been associated with an increased risk. Oxidative stress within the cornea may also contribute to its development. So while the precise trigger is unclear, a combination of genetic and environmental influences seems to be at play. Keratoconus literally translates to cone-shaped cornea. The healthy cornea is normally a dome-shaped structure. In keratoconus, the collagen fibers that give the cornea its strength and shape weaken. This weakening causes the cornea to gradually thin and bulge outward, forming a cone-like shape. This distortion disrupts the smooth surface of the cornea, leading to irregular astigmatism and blurred vision. As the disease progresses, scarring can occur on the cornea, further impacting vision clarity and potentially leading to significant visual impairment. Keratoconus affects people worldwide, but it's more common in certain populations. While estimates vary, it's generally believed to affect approximately 1 in 500 to 1 in 2,000 people. It typically begins during adolescence or early adulthood, usually between the ages of 10 and 25. The disease often progresses for 10 to 20 years before stabilizing. There's no known preference for gender or race, though some studies suggest variations in prevalence across different ethnic groups. Understanding the epidemiology helps researchers target resources for early detection and effective treatment. The signs and symptoms of keratoconus can vary depending on the stage of the disease. Early symptoms often include blurred vision, increased sensitivity to light and glare, and frequent changes in eyeglass prescriptions. As the condition progresses, you may experience distorted vision, difficulty seeing at night, and the perception of multiple images, also known as ghosting. Some individuals may also develop sudden corneal hydrops, where fluid rushes into the cornea, causing sudden pain and a significant decrease in vision. If you experience any of these symptoms, it's crucial to see an eye care professional for a thorough evaluation. Diagnosing keratoconus involves a comprehensive eye exam. An eye doctor will typically use several tests, including a visual acuity test to assess your vision, a refraction test to determine your eyeglass prescription, and a slit lamp examination to examine the cornea closely. Corneal topography, which maps the surface curvature of the cornea, is a crucial diagnostic tool. This imaging technique can detect subtle changes in corneal shape that may not be visible during a standard eye exam. Optical coherence tomography (OCT) can also be used to measure corneal thickness and assess the health of the corneal layers. These tests help confirm the diagnosis of keratoconus and monitor its progression. While keratoconus doesn't have strict classifications, it is often described based on its severity and progression. Mild keratoconus typically involves slight corneal distortion and minimal visual impairment, often correctable with glasses or soft contact lenses. Moderate keratoconus shows more significant corneal steeping and irregular astigmatism, requiring specialized contact lenses like rigid gas-permeable lenses. Severe keratoconus involves advanced corneal thinning and scarring, potentially requiring surgical intervention like corneal transplantation. This classification helps guide treatment decisions and manage patient expectations. The goal of keratoconus treatment is to improve vision and slow or halt the progression of the disease. In the early stages, glasses or soft contact lenses may be sufficient. As the condition advances, rigid gas-permeable RGP lenses are often used to create a smooth refractive surface and improve vision. Other contact lens options include piggyback lenses, a soft lens with an RGP lens on top, and scleral lenses, which vault over the entire cornea. Corneal cross-linking XXL is a treatment that strengthens the cornea and can slow or stop the progression of keratoconus. In severe cases, a corneal transplant, either partial or full thickness, may be necessary to restore vision. Your eye doctor will determine the most appropriate treatment based on the severity of your condition. Currently, there's no known way to completely prevent keratoconus. However, avoiding excessive eye rubbing is strongly recommended, as it can contribute to corneal weakening. If you have a family history of keratoconus, regular eye exams are essential for early detection. Early diagnosis allows for prompt intervention, which can help slow the progression of the disease and preserve vision. Managing associated conditions, such as allergies that may cause eye rubbing, can also be beneficial. The prognosis for individuals with keratoconus varies. With early diagnosis and appropriate management, many people can maintain functional vision for many years. Corneal cross-linking has significantly improved the outlook by stabilizing the cornea and reducing the need for corneal transplants. While corneal transplantation can be successful, it is still a surgical procedure with potential complications. Recent research is focused on developing new and less invasive treatments, such as newer forms of corneal cross-linking intrastromal corneal ring segments and advanced contact lens designs. These advancements offer hope for improved vision and quality of life for those living with keratoconus.